Hi, it's Elizabeth Moffett. I want to recap what we went over last week, and that was the dyspnea cycle. The dyspnea cycle is a series of repetitive breathlessness that is followed by anxiety, that is followed by inactivity that leads to muscle fatigue, and then it just keeps going on and on and on. What a lot of people do not realize is that there are ways to break that cycle, and we are going to go over those, but not yet, okay? The first thing that we need to do is to make sure that you have been properly diagnosed. This sounds simple, and it is kind of, but in a way it's not. You want to make sure that you've had the proper testing done for the diagnosis that you've been given. So, in simple terms, if you have been diagnosed with COPD and you have never had a pulmonary function test done, you need to have one done, okay? There are other tests that can lead to an answer as to what kind of pulmonary disease you have, if any. But the definitive test is a pulmonary function test, and the problem is that sometimes you'll go to the doctor, and just because you smoke and you've started having trouble breathing, they'll automatically diagnose you with COPD. They're going to give you an MDI, some nebulizers, and send you on your way. And that is, what is considered the quick and easy fix. But the problem is that that's not always the case. And I have found this many, many, many times that people will be misdiagnosed by their family doctors. And it's no fault of the doctors. I'm not saying that at all. I know that doctors absolutely do the best that they can with the time that they're given. And I also know that each patient will probably have about a 5 to 10 minute limit in there, okay? So what I'm asking you to do, like I said before, if you have never had a pulmonary function test done before, please call your doctor and ask to have that done, especially if you are already on medication for a pulmonary condition or you have been diagnosed with a pulmonary condition. Just please make sure that you have had one of these things done. And the reason I'm being so assertive about this is because over the past 10 years of my profession, I have seen numerous cases of patients who have been being treated for their breathlessness with MDIs and nebulizers when the problem was their heart. That is something you really want to avoid. The problem, obviously, is that they've been being treated for something for years that they don't have. But the other problem is that they've had a bad problem that hasn't been treated. So, obviously, that is your very first step, okay? So once again, it's called a pulmonary function test. Now, other than your heart, there are other things that cause you to get short of breath. One of the main ones actually, is being anxiety. So that follows breathing problems. So a lot of times people who have lung conditions will also have anxiety, but there are lots of times that somebody may just have anxiety and it's been diagnosed as a breathing problem, per se asthma or something like that. You want to watch for the anxiety. Obesity is another big one. People don't realize maybe that you've gained 20 pounds and you don't think that should really be making you so short of breath. But the problem with shortness of breath and obesity is that all of that weight is sitting on your lungs. So you're going to have to work harder to breathe. So we have the cardiac, we have the anxiety, we have the obesity. Also, another problem is chemical imbalances in your body, such as hormones. So, like I said, if you have trouble breathing and you're being treated for a lung disease, you just want to make sure that you in fact have that disease. So before I start going into breaking the dyspnea cycle, I urge everyone who is having trouble breathing to contact their doctor. Make sure that you've had a pulmonary function test done before. And if you haven't, request to have one done, okay? That way you can get a definitive answer and then you know what's going on, you know what you're battling. And then I'll be back in a couple of weeks to start going over how to actually break the dyspnea cycle. But I wanted to just kind of throw that out there at the beginning of everything because that's just something that's super important. So if you have any questions at all, you can always contact me, message me through Facebook. My name is Elizabeth Moffitt, and I'm on Hagen's Cardiopulmonary Rehab. So have a nice day, and I will see you guys later. Bye.